Hello and welcome to this week's Clarity Parents Chat. The topic we are going to discuss today is non-medical options for anxiety and depression in kids. My name is Gerard Mijon with the Clarity Child Guidance Center, and we look forward to an engaging conversation with our speaker, Dr. Jeff Gentry. For those who are not familiar with our organization, Clarity Child Guidance Center is a nonprofit treatment center solely dedicated to helping children 3 to 17 with their mental health. Clarity is located in the San Antonio Medical Center and provides inpatient and outpatient services to several thousand of children every year. You can read more about the center and about children's mental health at claritycgc.org. Before we start, a few technical details. The webinar will end at 11:30, including a 10-minute Q&A at the end. This talk is recorded, but none of the names of the attendees will show in the recording to protect your privacy. That is also why we are not taking live questions. However, if you have questions for Dr. Gentry, we invite you to post them in the chat space at any time during the talk. Of course, this event is purely educational and by no means an attempt to provide counseling online. Dr. Jeff Gentry is Clarity's Senior Vice President of Clinical Services and as such oversees the center's psychological programs and the clinical training programs, as well as provide clinical supervision and individual family therapy. Dr. Gentry serves as an adjunct assistant professor in the psychiatry department at UT Health San Antonio, where he teaches psychiatry and psychology residents and fellows. It's an honor to have this time this morning with Dr. Gentry. And Dr. Gentry, welcome.
Thank you.
So before we start speaking about treatment options, could you help us understand better what we're talking about when we talk about depression and anxiety?
Well, in the professional realm, we think of depression as on a continuum from low mood to high mood. Low mood is when someone appears down both emotionally and physically. So some common symptoms involve emotions, painful, unpleasant, negative emotions. Thoughts can include a negative view of oneself, of the world, of the future. An obvious symptom also is a loss of interest in things that someone enjoyed doing before, social isolation, being less involved with others, those kind of things. Anxiety is essentially about worry, and we think about the intensity, how intense is it, and also when we think about anxiety, we think about how focused is it on some particular thing versus how is it. So some people worry about very specific things like their finances, or some people who have to do public speaking and presentations may get very worried or stressed out prior to that. But there are also some people that experience what we call generalized anxiety, which is kind of worrying about a little everything. And we know that this pandemic has increased people's anxiety and also impacted mood in a way that we haven't seen before. Something that I've seen in assessing kids is we're assessing kids in our clinic that prior to the pandemic were functional kids and that were doing okay. I saw a 10-year-old recently who was just very, very anxious. He's at a school that's 100, and he was just really worried about kids there not wearing masks, not social distancing, and things like that. So we have a different spin right now on depression and anxiety because we have more environmental stressors than normal.
Well, that leads us actually to my next question. We know that depression and anxiety can be caused by a multiplicity of factors, right? Could you give us some of those main factors that are critical? You mentioned environment. Are there other factors?
Well, we look at some specific things. First, we look at the child or the adolescent. We try to some kind of assessment of their intellectual functioning, or developmentally, or where they need to be with academic functioning, and importantly, their social and emotional functioning. So we try to understand their developmental history and sort of their trajectory. Is this a situation that has always been a problem, or is this something that's new and it's related to something that's going on? And we also look at the family, and we try, because the child is obviously different than we were seeing adults. We see only kids and families. And so we want to know how the family's functioning, how well they relate, how well they communicate, how well they problem solve. We try to understand how well the parents are acting as executive unit for the family, providing guidance, support, discipline, and those kind of things. And we look for sources of support and stress in the family. Do they have enough support? Do they have too much stress? And how are those things working together? And then we also look at their role in the community. Do they have support from the community? Do they have specific unique stressors from their family's place in their community?
And you mentioned at the beginning about the child development and the his skills in some way, right? And so it beside the environment, so we kind of identify there maybe some fragility in the child. Is that kind of what we're talking about?
Yeah, when we do an interview, we start with, we want to know about the mother's pregnancy. We start there. Any problems there? Any problems at birth? What about infancy? Then we look at the period between toddlerhood to, and then I always want to know what was the kid's first exposure on a daily outside the home. And it could be daycare, it could be pre-K, it could be K. And I always want to know, what did the adults there tell you about your kid? And if a parent says they loved it, they thought it was great, okay, that's a good find, as opposed to a parent that says, well, my kid was excused from 3 daycares that he had to leave because he was very aggressive or something like that. That begins to paint a different picture of what we're working with.
And you mentioned earlier in the first question about kind of the sense of a continuum, right, from low to high mood. Can you describe about that how mental illness is on the continuum?
We think of mental health continuum, and we think that range on that continuum where we tend to function. There's a high level when everything's going the best it can go, and then there's a low level when we're under a lot of stress. And so we try to understand that. One person may work on the continuum of 0 to 10, may usually be in a 6 to 8 range, and another person may go from 3 to 6. And so we try to understand that in terms of a lot of social emotional development, problems, anxiety problems, thinking problems, those kind of things. We try to get a picture of where they are on a continuum. Boxes, as opposed to saying, is this person depressed or not depressed? We want to know, how does their mood track over time, and how resilient are they? How much support do they have, and how much stress do they have?
Yeah. That's very important, because that can actually, that gives parents a sense of, like, you're not, either sick or not sick, right? It's like you're working toward wellness, and everyone is in some way, but people who have more of a fragility need more help.
Yes, and more support.
And more support. So let's talk about that. And that the topic of our conversation today is what are some of the non-medical types of approaches that someone can consider when they're a sense of this is happening with their child.
So I think a little later we'll talk about therapeutic lifestyle change in a large area. What we do here centers around psychotherapies, and psychotherapy is basically using talk, discussion, conversation, and techniques within that to help people feel better, function better. We do individual therapy. In some cases, it's determined we want to work with a kid individually. We have a super supportive family, but there's other things going on internally with the kid that we want to work with them individually. We also do family psychotherapy, and family psychotherapy is pretty specialized, and I recommend, if people are seeking family therapy, to consider working with someone who's licensed as a marriage and family therapist, or at least has a lot of training in that and experience in that. Maybe a PhD in human development and family studies would be a good thing. And then we also do group therapies, which gives kids a chance to socialize while they're doing therapy and to gain some perspective on the problems and challenges that their peers face. And it also helps improve their peer functioning. Just in terms of types of or brands of therapy, the main ones that we know of are cognitive behavioral therapy, which focuses a lot on how we think about things and how our thinking can get in our way sometimes and kind of our patterns of thinking. Being rigid in our thinking can make stress worse sometimes. We operate also a lot from a psychodynamic model, which is very oriented toward insight and helping people improve their awareness of internal conflicts and things that they haven't quite figured out that are not lining up. There's specific therapies that are designed for certain problems, like there's EMDR, which is an eye movement that is for trauma. There's dialectical behavior therapy, which is for certain personality challenges and other things like that. And then, as I mentioned, family therapies like cultural therapy here a lot, which basically it starts with a genogram. Let's look at what your family structure looks like, including the generation before you, to try to understand some patterns within the family that may be affecting a child or children.
So that you mentioned a lot of therapy, and I want to go back to some of those types of therapy to some specific questions. But then you also mentioned earlier lifestyle changes. Can you clarify what maybe some habits or some changes in that can fairly quickly help improve anxiety or depression?
Yeah, there was an article written by psychologist Roger Walsh, and I want to encourage people to Google this. The article's title is Lifestyle and Mental Health. If you enter that in Google and the journal title American Psychologist, you'll get the article. It's very gettable. He points out in that article some things that we can do without outside help from a professional that we can do on our own that have scientific research that shows their positive effects for mental health, particularly in the areas of depression and anxiety. One is exercise and movement, just moving a certain amount per day. Hippocrates said, if you don't like your mood, go for a walk. And when you come back, if you don't like your mood, go for another walk. So the idea of movement, and nowadays there are a lot of apps for counting your steps and things like that. People who move a lot tend to feel better in terms of mood and just their psychology. There's nutrition, and diet is huge. What we put in our bodies makes a lot of difference about how we feel and how well our body is functioning, which is, sort of a foundation for good mental health. We need to have good physical health. And he mentions in that supplements and the importance. Omega-3s, like fish oil omega-3s, have been proven to have a positive impact on mental health. And so if you take a look at the article, you might think about whether you want to have your kids, ask your pediatrician about your kids taking some fish oil and some other things that are mentioned in that article. There's also evidence that being in nature has positive effects on mental health. So hiking and being outdoors, there's good evidence for that. There's even some research that shows that people who are recovering from surgery do better if they have access to a view of nature than people who are just in a building. Regulating social media and involvement in video games, stuff like that also has been shown to have a positive benefit for mental health. Relationships are foundational, and we are hurting on this one right now. We're not able, and we're realizing how much we miss the opportunity to have actual in-person interaction with other people. Recreation and enjoyable activities seems kind of obvious, but that's been shown to be related to improved mental health. Relaxation and stress management, things like mindfulness. And finally, religious and spiritual engagement has also been shown to have some positive effects on mental health. So all of those things are in this article, and they're all things that we can do on our own, and a lot of them at no cost.
Yeah. No, that's very helpful. I put the link to the article again in the chat box, but the title is "Lifestyle and Mental Health" by Roger Walsh, and the link is on the apa.org. You'll find it there. So that's indeed a lot of great kind of building block of how to re-engage. And sometimes you probably have, if you have someone who's pretty depressed or pretty anxious, I mean, imagine that the parent has to really, work hard to get the child to engage in those lifestyle changes. Possibly, can you comment on that a little bit, and how parents can be, how do they, live that?
Well, you're exactly right. One of the features of depression is sort of withdrawal and loss of interest and pleasure. So it depends on the kid, and the main thing is you've got to get up and do it, and so psychoeducation about helping someone understand why this is important and what it will do for you. It may feel like it would feel better to just stay in bed today, but here's what we know. And to get better, we've got to participate. We've got to contribute to our own mental health. It varies kid to kid, and it depends a lot on the nature of the relationship between a kid and their parents.
Yeah, and that can be a challenge. I want to encourage anybody on the call to, if they have any questions, please feel free to put them in the chat box at any time. Now, if the child is not responding to the parents, or even maybe the parents is helping with some activities or trying to, but the child is not responding, can you explain some of the short-term therapy or therapies that can help the child make a change?
Well, as I earlier, it depends a little bit on what's going on at the moment in the family. So I always want to know what's been going on for the last 2 to 4 weeks. And the extent to which the family, the parents as the executive unit, the executive functioning unit for the family, the extent to which they are in good alignment with it, and what's the communication like. And if communication is a problem, particularly if mutual respect has become a problem to have, then I like to think about family therapy, because if we just focus on the kid and there's a breakdown in communication, that's not going to work.
So that would be like if there's a lot of conflict in the communication or absence of communication.
Yes, it not only just a lot of conflict, but there could also be some sort of withdrawal and disengagement. That's another thing to think about.
Yeah, avoidance.
Yeah. So it's really sort of assessing the quality of the relationships and the communication to determine. And we see some kids who their parents are super supportive, they're very respectful, and the kid is just going through a hard time, and we work with that kid individually. So one thing I want to mention is, and I'm curious about how do you access resources, or how do you kind of evaluate? And I've got one resource for that I'll talk about a little bit later.
Okay. Now, going on you mentioned in the therapy, and I wanted to kind of go back to that therapy information you gave when you talked about working on the internal conflict. So the approach of therapy that helps a person to understand what's going on inside. Can you comment a little bit of that? Because we know. I mean, we talk a little bit. You talk about the family therapy and the communication, super important. What about the internal functioning of the person?
It depends on their age and developmental level. So younger kids, say a kid who's 4 or 5, will tend to family therapy with sort of behavior management strategies and teaching what to do rather than so much what to say. With younger kids, it's much more about what you do than what you say. And then for older kids, kids that are coming into adolescence where identity and things like that, identity development become more important. And particularly for kids who are more verbal, we begin to work with language and with their ideas and what's going on inside. And so people can be conflicted. On the one hand, I think this, but on the other hand, I think the opposite. And that can happen as a kid. One of the things I try to understand in families is, how does a kid say no in your family? How does a kid say, that's not me? I don't want to do that. How does that get worked out? And is there a constructive process for that? Or is maybe the rule in the family is the kid doesn't say no, or if you say no, it's going to be a problem. So that's, again, trying to understand sort of the external conflict. But sometimes the kid can take that external conflict and go internal and say, I'm just not going to talk because I can't say no. So I'll spend most of my effort and energy somewhere else.
Now, I imagine also, and I'm actually reading a book. We have a speaker coming up next week, and her name is Kate Fagan, and she wrote a book about What Made Maddie Run, which is a book about a young college athlete who, hit a wall, and she had signs, but it was hard to see them, and then she ended up ending her life. So but the question I have is what do you do when you see that your child is hitting a wall? It's a sense of like, okay, the child is not responding. How do you know when to really do something maybe more significant?
Well, again, it's hard to generalize something like that. But what I can say is, you look at the kid's ability to fulfill their roles, their multiple roles, ability to fulfill their role, say as a student, as a member of a sports team, as a child, as a brother, as a peer, as a whatever their roles are. When you start seeing those begin to break down, this kid used to be in band, but he's just going to be in band this year, and doesn't have any reason and won't talk about it. Okay, that's a change in his ability to fulfill that role. So we need to think about that. And one of the things, this is one of the most common things I've heard after I do an assessment of a kid from parents is, I wish we had done something.
Yeah. Well, I have a couple of questions here. One is, how do we handle a child when divorced and one parent doesn't recognize the problem and no co-parenting?
Well, again, situations are so specific, and it depends on the strengths and the weaknesses of the folks that you're working with that guide the answers to that. But one thing is to try to engage the other parent, and if it's serious, if it seems serious enough, try to engage the other parent. Let's just at least have a consultation with a professional and get some feedback. Maybe the feedback will say maybe it'll say you're off base, maybe it'll say we're both off base and we need to think about doing things a different way. But I think get consultation, and I want to be sure to get this in. A resource that I use is the website for Psychology Today. You can Google Psychology Today Therapist, and it'll take you to a site that will serve therapists, psychologists by zip code and location. And you can also select, if you're using insurance, the kind of insurance you have, the age of any kids you have, if you're looking for family, if you're looking for individual, if you want a male therapist, whatever. There's a lot of ways to select that. And then I end up referring some people that way, finding therapists say in a place outside San, a town I don't know. I can at
Right.
least look and kind of try to make some. So that's one resource for finding help.
Now I have another question, which is about a mom who has a 12-year-old and had a good relationship with her, but that 12-year-old has very bad anxiety, and she comes and talks to her mom about what is worrying her, but the mom is not really sure what to say. Stop worrying doesn't seem to help.
Yeah. The guidance I give in training is to ask 3 questions for every statement. There's a psychologist sometimes lead with genius, what he calls genius solutions, which is basically telling kids what to do without understanding what they're really saying and what's really going on. You can't, this is not just in general, I think ask too many questions, you can't know too much about your kid. So don't assume you know everything that you need to know. And it's a lot easier for kids to deal with questions than to be told, what they need to.
Jeff, you were cutting up a little bit. You said there were 3 questions, or as I mean, yeah.
I'm saying keep a ratio of at least 3 questions to every statement you tell your kid.
Got it. Yeah. So it's really more about investigating and listening to try to get the child to share. It's great when you have a relationship with a child and the child is sharing, right? Now, at what point, maybe for a parent like this, at what point do you think like, okay, I'm listening, I'm hearing, but there's a sense of that's not going away, or that's not helping enough.
You listen to your gut. Your kid, who knows them better?
Yeah.
If you feel like you don't have something that you need in order to be helpful to your kid, that you've reached a plateau and they're not getting better, or maybe they look like they're it's getting a little worse. It takes a lot of courage to reach out and ask for help. And when you ask for help, you don't have to accept what you get. One thing to understand, this is an important fact, and it's backed up by research. When you see somebody for psychological counseling or therapy, if it doesn't feel like a fit and there's no movement in 3 or 4 sessions, you need to think about trying something else. And I always say to people, when you're going to approach a therapist, don't ask them to be your therapist. Ask them to provide a consultation meeting to you, so you can tell your story and then hear their recommendations, and then you can go away and decide if you want to come back or you want to try something else. We could have a medication and it doesn't work. We go to a and the research in psychotherapy says it's the fit between the client and the professional that predicts a good outcome. It's not the professional's training. It's not whether they're male or female. It's not whether they're doing CBT or. It's the fit, and it's the extent to which the family feels like we're talking about what we need to. We feel respected, and we feel like there's some movement.
So that.
To change course, if it's not working pretty soon, it doesn't mean it's a bad therapy. It doesn't mean that there's something wrong with you. It means probably you don't have a good fit for some reason, and you don't need to figure it out.
That's really key. And the word you use is a consultation meeting, right? So that's what you request from the provider.
Yes, I would say I'm having this issue with my kid. I've reached a place where I don't know what to do next, and I just would like to be with you and tell you what's going on and see if you can give us some recommendations.
Excellent. One new question that just came up is someone is saying she's nervous about giving medication while her child's brain is still developing. What are your thoughts on that?
Well, I think that's a good and to be focused on. I'm not a psychiatrist. I don't administer medication. So I'm limited in what I can say about that, but my professional that I'm working with, that I really, really trust them and their guidance, that and if it doesn't feel right, I'm going to move on and make me feel comfortable and yeah.
And we get yeah, say I mean that sometime a patient will have medication for just a short time, right? I think the fear that medication can be like this is a lifelong, uh, you know, need, and not necessarily.
Not necessarily, but I think we need to know what the plan is before we start, and we need to know what the
Yeah.
intention is. Is this expected to be long term? Is this a supportive adjunct to psych until things stabilize or what? But we need to know. We need to have a treatment plan, and people who are being treated, psychiatry, psychology, psychotherapy, you have a right to know what the plan is specifically as possible.
Well, very good. Thank you, Dr. Gentry. This concludes our parents chat today. Thank you very much for this very helpful information. I would like to invite everyone on this call and also mention it to your friend to join us on our next event, which is in 2 weeks. We're going to have Strong Mind, Happy Hearts, which is a family event. So it's a more than just information. It's also a conversation about children's mental illness. You can find this on our website. If you look into on our Clarity cgc.org/event, you will find the information about this and how to register. Again, thank you, Dr. Gentry, and thank you. Take care, everyone. We'll see you soon.